I'm Dr. Keith Egan, a board-certified family medicine physician with the Mid-Atlantic Permanente Medical Group, practicing in DC and suburban Maryland regions. I'm joined today by my incredible colleagues, Dr. E.W. Emanuel, Dr. Stephanie Letourneau, and we hope to be joined as well by Dr. William Narracci, who's running a little late with patients, but hopes to join us. We are all practicing in the DC and suburban Maryland regions. We are excited to be talking to you today about LGBTQ plus health in honor of Pride Month. We're going to start off by having my colleagues introduce themselves, starting with Dr. E.W. Emanuel.
Hello, I'm Dr. E.W. Emanuel. I'm a board-certified OBGYN and have been practicing with the transgender community for the past 9 years. Thank you.
Hi, I'm a board-certified family medicine physician. I trained in Montreal at the McGill University, but I have been working in the Washington, D.C. area, providing primary care mainly to LGBTQ patients for the last 12 years.
All right. We're looking forward to your questions. So if you're watching live, please post in the comments section, and we will try to address them at the end of the session today. We're going to start off by talking about some of the routine health maintenance for LGBTQ plus patients. For my patients, even for routine health maintenance, this all starts with a discussion and is very different for each patient. So the best place to start for this is a discussion with your primary care provider. I suggest finding a primary care provider that you're comfortable with, going in and meeting them. Even if you're not planning on doing an annual physical, having that first face-to-face discussion is very important to go over your personal health history, your family history, and let the primary care provider know a little bit about you. From there, you'll be able to figure out what lab screenings, cancer screenings, and office visits are needed and the frequency of those. Dr. Emanuel, do you have anything to add regarding health maintenance that you suggest for your patients?
I would piggyback off of everything you just said, but I'll also add in the trans community, it's remembering that a trans woman with a family history of prostate cancer needs a prostate exam, or a trans man for the same who has a family history of ovarian cancer and still maintain their ovaries to be screened for such, or breast cancer. So that's what I would add.
Excellent. And Dr. Emanuel, sticking with you, what are some of the qualities patients should look for in a provider trying to address the needs of the LGBTQ plus community?
You know, just as seeing a physician in the cisgender community, someone who's compassionate, someone who is caring, who finds time to address your personal issue. But as it pertains to to a marginalized community like the trans community, it's someone who's an advocate, understanding the institutional biases, structural biases that prevent them from seeking care or being comfortable while in care. So for example, it's for a trans man who's being scheduled for surgery, who has never had skin-to-skin contact, who is on T, is there really an indication for pregnancy test? It really unaffirms the individual as a man. So finding someone who can be that advocate and recognize those obstacles that may prevent a trans individual from seeking care.
All excellent points. Thank you, Dr. Emanuel. Thinking about some of the screenings for sexually transmitted infections for MSM, WSW, transgender male and female patients. This, again, kind of is important to start with a discussion with the primary care provider or OBGYN and the patient to discuss frequency of sexual activity, types of sexual activity, and go from there. It's very individualized from patient to patient. There's no kind of set rule for MSM, for WSW, for transgender male or female patients, for gender expansive patients. It needs to be a discussion based on the patient's comfort level and based on sexual activity and frequency of sexual activity and type of sexual activity. And so it's important that patients find a provider that they are comfortable with, that they can dive into these details with, so that it can be an informed discussion and individualized. Dr. Letourneau, do you have anything to add to how you address those discussions with patients?
I think you covered it pretty well. It's important to listen to your patient, have a conversation with them about what they're doing, how they're doing it, with whom, and then you develop a plan based on their needs to make sure that you screen them well and that you don't miss anything. It's important that patients feel comfortable to come to you and talk about what's going on. And so it's the provider's job, it's the physician's job to create that environment where people feel comfortable sharing what's going on so that you can best advise them to reduce their risk.
And Dr. Letourneau, can you tell us a bit about how you approach care with your transgender and gender expansive patients?
I'm a primary care provider, that's my training. So my approach is really based on being someone's doctor and being someone's primary care provider. It's centered on healthcare needs and on making sure that we do all the preventive care that is needed for a particular individual. It's important to understand who this individual patient is and what their goals are. If gender affirming care is part of their goals, then it's to have a conversation and develop a plan that's individualized to address what their goals are for that type of therapy. The core of my role is to be their primary care provider and to provide a space to address their healthcare and their mental health care needs, and to either provide some of the gender affirming care if it's something that I can do in my office, or help them coordinate with the other specialists that might be needed depending on the situation. But it goes back to primary care. You know, like after someone is happy with the care they've received, they still need a doctor when they have a sore throat, when they need to be screened for STDs, or when they wonder if they need a mammogram. So it's really about being someone's doctor.
Excellent, thank you. And sticking with you, Dr. Letourneau, how can transgender and gender nonconforming members access gender affirming care? So depending on an individual patient's goal in gender affirming care, a patient can have to interact with one or multiple physicians, surgeons. So we have at Kaiser, at KP, we have a case manager, a nurse case manager who specializes in coordinating the gender affirming care for our transgender patients. So the care can start with this case manager. This person is available for consultation. So patients who are looking to start or continue their gender affirming care and have not talked about their provider, or maybe have not met their primary care provider yet, can call this person. This nurse case manager, the phone number is 301-321-5126. Leave a message with your name, your medical record number, and mention why you're leaving the message. Or you can go through me if you're already in care with me, or with your primary care provider, and they will be able to refer you to this nurse case manager, who will help you navigate. I don't like to use the word system, but for lack of a better word, to navigate the system and make sure that your care is coordinated across the different specialty you might have to meet with in order to enact your gender affirming care. Excellent, thank you. And Dr. Emanuel, would you be able to talk to us a little bit about the health disparities that LGBTQ+ communities face and how healthcare can play a role, healthcare systems can play a role in addressing those?
Sure. So I'll start with the same gender loving individuals, so women having sex with women. We do see that there's just disparities in tobacco utilization, in cervical cancer or breast cancer screening. And I think it's important that the community, whether it's the patient or the physician, recognize that it does exist. It's imperative for women to follow up or seek out a physician who is quite knowledgeable of these health disparities, needing cervical cancer screening, not just performing it, but how frequently should it be done? Women less than age 30 needs it every 3 years, and 30 and older needs it every 5 years. When is it time to do a mammogram for breast cancer screening? So those are just a few. It's important with HPV. Some lesbians or women who have sex with women may use toys, and the HPV virus can also pass or be transmitted that way. So HPV screening and vaccination are important in this population. When looking at my trans women, it's important for them to be screened according to their activity. So if they're having sex with men or sex with women, the screening rules should be adjusted according to that activity. But also, if trans women are at increased risk for HIV, and PrEP is very important in that population. So having a provider that is sensitive and knowledgeable about their risk factors, just because they're placed in a marginalized group, is an important aspect to their care.
Thank you for that. All right. Today I'm excited to share with you that we have a new program launching later in June called Pride Medical at Capitol Hill that offers primary care, gynecology, and case management in one dedicated area. Clinical assistants, nurses, and other staff members have received training in the LGBTQ plus care to support a comfortable and welcoming environment. This program is an optional program that provides an additional site of care for LGBTQ plus patients who choose to access care there. More information about this program to come and how you can make appointments is coming soon. Either Dr. Letourneau or Dr. Emanuel, do you have any additional comments that you would like to share with patients who are looking to establish new providers, or any experiences that you've had with patients that kind of demonstrate the unique needs of the LGBTQ plus community?
Certainly. So I think that, again, drawing on my primary care background, I think that the comments that I will get from patients who meet me for the first time is that they're happy that for once they didn't have to explain so much to their provider, that they could just come and talk about what is going on and, you know, receive the care they needed for the situation without having to explain or face a moment where they weren't sure if their provider understood what they needed and where they came from. I'm very excited about this program too, because I'm hoping to address some of the health disparity that some LGBTQ patients have lived and faced by providing a place where people will feel comfortable and will feel confident that they can come in, receive the care they need in a calm and accepting way, if you want. So as you said, it's optional. It's one of the things that one of the ways that people can access care at KP. But if you are looking for someone who has that angle to their practice, I think it can really make a difference for patients. And I'm looking forward to work with you in this program, Keith. Dr. Egan, sorry, and Dr. Emanuel.
So I would just add, I have faith that my colleagues across the region are capable of caring for patients. And that also includes the LGBTQ. Mm-hmm. But there are uniqueness to this population. Mm-hmm. So I'm fortunate that I can see my patient in different locations. So at Capitol Hill, where I see the majority of patients, but also at our Largo, or it may be our Gaithersburg Surgical Center. And I find that advocating for them is very important on the continuum of affirming who they are as individuals. I think my colleagues are accustomed, whether it's the anesthesiologist, the OR nurse, the pre-op nurse, are accustomed to seeing me and my population. But it took work. It took work in explaining the population, the fluidity of the population, and that their needs are no different than any other patient's needs. And that it was important for them to know that affirming who they are, it's just as if you look at it in any marginalized community, whether it's a person of ethnic minority, someone who is minority of gender, these patients, the transgender population, are the same. They face the same barriers. And when they experience that resistance, or what they may interpret as being, let me say it nicely, someone who is not welcome, it really then can set them on a course of a bad outcome, even when we never have not touched or operated on the patients. So I find that preparing my colleagues for this population benefited a lot. I also have given every trans patient that I operate with or on my cell phone, and that they can text me with very simple questions prior to or after surgery. I do stress to them that it's an emergency. They should still follow the Kaiser Permanente protocol. Is the number on the back of the phone. And the feedback that I've gotten is that it really helps. I also gotten feedback from my colleagues at these surgical centers that teaching them, informing them of the population has also helped in the overall patient experience.
Excellent. Thank you very much, Dr. Emanuel. Dr. Narracci, we are very happy to have you join. Thank you for being able to make it today. I know you had a busy morning. Would you mind introducing yourself to the group, to the event? And then if you have any comments on health disparities that our LGBTQ plus patients face, particularly with respect to mental health and how you suggest our patients navigate any mental health concerns, we'd appreciate hearing your input.
Sure. Hi, everyone. Apologies for being late. My name is Dr. Will Narracci. So I'm a family medicine doctor here at the Capitol Hill Medical Center in the Department of Adult and Family Medicine. Originally from Colorado, I went to osteopathic school in Iowa, and then my residency out here in DC at Georgetown. And I've been at Kaiser for almost 4 years. And let's see here. So and we probably covered some of the disparities that our LGBTQ plus individuals face just in general. But mental health challenges are really important for us to keep in mind, and especially over the past year with the pandemic. So the good thing is that access to behavioral health services is pretty simple from a bunch of different avenues. So people can call in to our member services number and schedule that way. They can book appointments themselves online through our portal. If there's ever emergency services needed, especially if someone's worried about the safety of themselves, they can call anytime, 24/7. We have an on-call behavioral health team that can talk with people and kind of get them the help that they need. We also have addiction medicine options too, if folks are struggling with that. We have chemical dependency specialists, physicians who can help with treating people for drug and alcohol addiction. We also have counseling available, so lots of options there. Kaiser also has purchased access to the Calm app, which is app available to all of our patients. It has a ton of resources as far as managing depression, anxiety, insomnia, lots of really common things that people are struggling with. And I know that, mental health and behavioral health are a big focus for Kaiser, especially this year. So we're working really hard to have as good of access as we can for patients, help them get plugged in with providers and help our folks out. So, yeah.
Excellent, thank you. And for anyone who's joining us on Facebook, again, if you have any questions, please feel free to put them in the chat box. Dr. Narracci, since we didn't get to hear from you more earlier, I'm just going to ask you if you have any suggestions for patients on kind of how they should approach initial visits with their primary care provider and kind of finding a primary care provider that they're comfortable with.
Yeah, definitely. Lots of ways to do that as well. So through kp.org, which is our portal system, we have a way for people to check out physicians ahead of time, read through their personal bios and kind of their interests as far as areas of care that they focus on. As far as specifically wanting to get in touch with one of us, the providers at the Pride Medical Clinic, they can call the main call center number and they can get an appointment that way. For patients who are not close to the Capitol Hill Center, and if they go to a different Kaiser Center, they can still choose their primary doctor, whomever they would want to talk with. If they have a specific question or service related to LGBTQ care and either their provider is not as experienced with that, or if the patient would like to talk with us directly, we do virtual visits. We can, there's a lot of options to do that to help so that even if you're not in DC, we can still meet with you and go over any concerns. So those are our main things for our transgender patients or gender expansive patients, especially if you're considering starting any sort of transition process. Then we also have our case manager, and we have a way to connect you with her directly too, to kind of get that process started or talk over what that looks like. Is that kind of, did I miss anything? I think that's.
Oh, that's perfect.
Okay.
That's perfect. All right. I'd like to offer an opportunity to our panelists before we close for the day. If you have any kind of closing comments or anything that you feel like was left out of this discussion that the community would benefit from.
I think that we talked about our team as a primary care team, but I also want to put out there that we're available for more punctual questions or visits. If you're happy with your current primary care provider, but you have something specific that you think that you might have better answers from us for I'll give an example, PrEP, pre-exposure prophylaxis. So if you want to talk about something specific like that with one of us, you can make an appointment just for that purpose with one of us and continue to receive care with your primary care provider. So I wanted to let people know that we're available both as becoming your primary care provider, but also answering a punctual question. And EW, you are also, in a sense, available in that team in that capacity because you'll be there for things that might not be longitudinal. It might be for a colposcopy or something like that for a specific patient. So, yeah. So we're there for both types of situations or clinical consult.
Yeah. I'd like to add that, as she said, if you're happy with your provider, continue. But also phone a friend. Tell them about us. We're here for consultation as well as treatment, and it's in a very caring capacity.
Mm-hmm.
All right, perfect. So just a reminder to everyone, keep your eyes open for more information on Pride Medical at Capitol Hill. We've been working really hard on getting this program ready. We're excited to launch it later this month, and more information is to come. We've also been putting together a list of preferred providers for the LGBTQ plus community, providers who have additional experience and comfort levels in working with this community, and that we're hoping to make that list available to members soon so that they can look for providers closer to their community if you're not close to Capitol Hill who have this additional experience. Thank you all for joining us today. If you've enjoyed this conversation, please share it with your friends. You can also follow us on Facebook, Twitter, LinkedIn, YouTube, and Instagram. You can learn more about our integrated multi-specialty medical practice and find lots of great health information on our blog at kp.org/doctor. From all of us at Permanente Medical Group, be well and happy Pride.
Bye.